Hi, my name is Melinda, and I'm 49 years old. And I met Dr. Gross at a gathering from a friend of mine that took me to him. And he's a wonderful doctor. I wanted to have a rhinoplasty for my nose, and I wanted to have my neck I wasn't happy with. I wanted to have it lifted. So I did perform both of them, and it came out fabulous. 11 years ago, I was in a car accident, and my nose was broken in 11 places. And it was very uncomfortable and very noticeable what the hump was. And I was very sad about it because it brought back a bad memory. Every day I looked in the mirror and saw it and went like this and watched myself. And now it's gone, and I'm happy. I'm very happy that every day I look in the mirror and it's beautiful. It's my nose back again. And I really appreciate Dr. Gross and his wonderful work.
In Melinda's particular case, she wanted to have some improvement in tightening under her jawline. So we customized the procedure for her, which is called a mini lift, and we also improved her neckline through the neck lift. So when you actually see her before and after result, you can see smoother, tighter jawline and a nice curve underneath her chin. She's very happy with the results, and we actually hid her incisions beautifully. They're basically invisible.
Dr. Gross is a very laid-back and knowledgeable doctor. I felt very comfortable with him as soon as I met him. And we sat together and looked at computer images of before and after. And my after is actually better than my computer image. He's a wonderful doctor. I trust him completely with my face because that is what he's known for, faces only. The day of my surgery was a wonderful experience. I came here at 6:45 a.m., which I'm definitely a morning person, luckily, because that's very early. And Sarah, the nurse, let me feel very comfortable with everything, answered every question I had, and then Dr. Gross came in, answered a few more questions, and then the surgery was over.
In the case of a mini lift, the customized incisions that we use for Melinda, we make a small incision underneath the chin in the first submental crease, so it's hidden very well in upright repose. And then we actually hide the incision in the pretragal, which is in front of the ear, but behind the little cartilage, and sweep it up behind the ear. So it's actually hidden in the hairline from the top to the bottom. When it's all said and done, it's essentially an invisible incision, and patients really appreciate that, especially Melinda, because she has an active outdoor lifestyle.
2 weeks after the surgery, the pain and the swelling was very minimal. I was actually, Valentine's Day was 2 weeks after the surgery, and I went out to dinner. I'm so glad that I did this procedure. It has totally made me feel wonderful about myself and the way I look. In the mirror every morning, I just am amazed that I feel youthful again, and I don't have to worry about that terrible memory anymore.